Good morning. Welcome to Breakfast. You're with Charlie State and Naga Monchetti.
Our headlines today: calls for the compulsory wearing of face masks. The government says it is looking at the issue.
In the Chinese city of Wuhan, the source of the global pandemic, the death count has been increased by 50%.
The nation salutes the frontline workers putting their lives at risk as we clap for our carers.
And coming up, an exclusive with the Duke and Duchess of Cambridge on life in lockdown, and a thank you to our war hero Tom Moore.
He's a one-man fundraising machine, and God knows what the final total will be, but good on him, I hope he keeps going.
That I think is absolutely amazing that my super prince can say some things like that.
And good morning. As Premier League clubs meet today to discuss how they plan to end the season, UEFA are working on an idea for the Champions League final now to be staged at the end of August.
Good morning. It's Friday the 17th of April. Our top story today: the Mayor of London has called on the government to change its advice on people wearing face masks.
Now, despite UK public health experts not currently recommending the use of face coverings to combat the spread of the virus, Mr Khan spoke on this programme just a few moments ago and is lobbying for the guidelines to be changed.
I'm guided by the science, but what I'm lobbying for is for where you, at the moment, where you can't keep your social distance, wear a non-medical facial covering. But when it comes to exiting lockdown, we may need to have all of us wearing it as well.
Well, in the last half hour, the Transport Secretary Grant Shapps told us there is mixed evidence on the effectiveness of masks, and the government would be guided by the science to ensure the public are given the correct advice.
There is also evidence out there that wearing it could be counterproductive. And so rather than sort of jump to the incorrect conclusion and do more harm than good, I think it's right to ask the scientists to provide guidance on it. It looks like it's quite a marginal case. But if the scientists come out and say, yeah, this is actually what people need to do, then fine, we'll absolutely ask people to do that. But until they do that, and unless they do that, that isn't the message that we're going to be sending.
Well, we can talk to our political correspondent, Layla Nathu, now. Layla, it's interesting, this one, isn't it? Because when you think of all the pressure and the criticism the government has had as whether or not it quickly went into lockdown, now the issue of face masks is being brought up and people saying, look, if we're going to have to wear them, let's just do it sooner rather than later. But the science is conflicting.
Yeah, and I think the message from government, you heard from Chris Whitty, the Chief Medical Officer for England yesterday, that the science is evolving. He was saying this is a live issue being considered. Scientists advising the government, you heard from Grant Shapps, are considering this now, weighing up the evidence all the time. So the evidence for how it can slow the transmission of coronavirus is still under review. You've also got a team of scientists from the Royal Society who are now producing a piece of work on how to end the pandemic. They are also going to be looking at this evidence. But I think, you know, it speaks to the wider point of what measures can be put in place in place of the restrictions that we currently have to help normality resume somewhat. But I think, you know, we're going to see these differences of opinion. Sadiq Khan obviously thinks it's a more pressing issue in London. One weapon in the armoury of Londoners travelling on public transport, for example. But clearly it's not something the government wants to risk advising yet, because they feel that it risks confusing the message, detracting from other social distancing measures, the hand washing advice, the advice to stay 2 metres apart. They think that it could risk confusing people and giving them a false sense of security.
OK, Layla, thanks for taking us through that.
Meanwhile, there are continuing concerns over PPE provisions. One NHS trust has told the BBC it fears that its staff don't have enough gowns to get through today, while another says they've been forced to reuse disposable masks. Brands like Burberry and Barbour are manufacturing garments for healthcare workers to help with the demand, but there are still problems with distribution. The government says it's working around the clock to get frontline staff the equipment they need.
China's Wuhan city, the epicentre of the coronavirus outbreak, has raised its official death toll by 50%. The number is now more than 3,800.
That revised figure was revealed after Beijing dismissed claims it had underreported the fatality rate. China has not yet provided an explanation for the rise. Earlier we spoke to our China correspondent Robin Brandt to find out more details.
What we have is a retrospective revision by officials in Wuhan. So it's coming from people running the city where this all began back in December, of the confirmed cases and the number of people they say have died from this new type of coronavirus. They have now added 1,290 people to the new death toll. That is an increase of precisely 50%. They say that's because there were inaccuracies very early on in the outbreak in terms of hospitals reporting, the amount of registering they could do as well. They've had a chance to go back and look at that. Now things, frankly, in Wuhan are much calmer. And so they have revised both the death toll and the number of confirmed cases. One of the most intriguing things is there's been a fall of just under 1,000 in the number of people they say were discharged and cured, but an increase in that death toll. But as I say, a revision in numbers, but it will just add to suspicion and doubt now.
Robin Brandt there talking to us earlier.
Donald Trump has set out his plans for lifting coronavirus restrictions across America. At a White House news conference, he said governors would be allowed to tailor their approach to meet their state's individual needs.
Critics say the US president is being over-optimistic about how soon the crisis will pass. Our North America correspondent David Willis has more.
He'd wanted a sudden, more dramatic end to social distancing guidelines. In the end, President Trump settled for a more gradual reopening of the American economy, one that will vary from state to state.
We're opening up our country, and we have to do that. America wants to be open, and Americans want to be open.
President Trump said it would be up to individual state governors to decide when to relax the existing guidelines. He unveiled a document called Opening Up America Again, a three-phase plan for easing the current lockdowns. In order to move from lockdown to phase one, for example, the guidelines say there should be a downward trajectory of coronavirus cases over the course of 2 weeks and a fall in the number of people testing positive. Hard-hit areas such as New York are expected to be subject to social distancing guidelines for quite some time. But the president said other states would be in a position to reopen soon, possibly very soon.
Those states that are in great shape already, yes. They will be able to go literally tomorrow, yes, because they've met all of the guidelines.
The administration's guidelines don't include provisions to increase testing for the coronavirus, something that Democratic lawmakers regard as key to controlling the spread of the virus. With more than 20 million Americans now out of work, a growing number are reliant on food handouts. The coronavirus has wiped out nearly all the job growth here since the Great Recession more than a decade ago. President Trump was forced to shut down the world's largest economy just as he was about to ramp up his bid for re-election in November. Little wonder, then, that he is eager to get things back to normal. What sort of normal that will be remains to be seen. David Willis, BBC News.
Time now is 8 minutes past 8. We're going to indulge ourselves and everyone else with a little moment of reliving, in a way, what happened yesterday. Captain Tom and that extraordinary amount of money that was raised.
Do we know, again, it was 17,300,000 just a few minutes ago.
We're going to have a look now at the page.
Can we see it? Have you got it?
Check in.
No? Have you got it? Let's have a look. There we go. 17,700,000. My goodness. It's just going up and up and up. And, of course, all the celebrity congrats have been coming through. Here's one you might enjoy. Oh, no. Well, you would have enjoyed it. Lots of people. Didn't we have Harry Kane give a message earlier? And that was a really sweet message for Captain Tom
One
Moore.
captain to another. Indeed.
I tell you, Captain Tom Moore was really, really pleased, though, to see Prince William congratulate him as well.
Very
he was
special
really
moment,
chuffed, wasn't he?
And if Captain Tom is watching this morning, I know he's a regular viewer, as he told us Good Friday when we first met. I'm rather hoping he's having a relaxing day, but we understand that he is planning to continue.
Yes.
Regardless, you know, the specific challenge is over, but he's going to carry on. So there you go.
We love Captain Tom.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.